BHP will require mandatory vaccinations by 2022. Let's have a look. Hello everyone, Florian.Heise here, and welcome to another episode of HeiseSays. Grab your stein of coffee. We're going to have a look at an email leak from BHP looking at their requirements for vaccinations for everyone attending their sites, beginning in 2022, so not that far away. Now, I'm not at all surprised that this is happening, to be quite honest. They need to, they need to provide a safe and healthy environment for their workers, but they also need to mitigate the risk of mandatory government shutdowns of their facilities. Can you see that happening and the fear and concern there? So let's go through this email. And as requested, I've redacted and hidden information that could identify where this came from. Throughout the COVID-19 pandemic, the health and safety of our people, their families, and communities in which we operate has remained our number one priority. You will recall on the 31st of August 2021, I announced a step up in our response to the COVID-19 pandemic through workplace vaccination pilots and the commencement of an assessment to determine whether to make vaccination a condition of entry to BHP workplaces in Australia. Now, I wonder, you can understand on some of their more remote facilities, but this is going to be everywhere. Over the last 5 weeks, we've been rigorously undertaking this assessment, including ongoing engagement with our workforce. The assessment has included a review of the latest health science, expert advice, and feedback from many stakeholders, including our employees and contract partners. The feedback and views you have provided have been greatly appreciated and have been considered through the assessment process. Today, I want to provide you with an update and share the outcome of the assessment. So, the findings. The emergence of the Delta strain has increased the COVID-19 risk profile across Australia. The Delta strain is at least twice as infectious, and in most cases, where the restrictions have been eased, there has been a corresponding significant increase in infections. We expect to see a similar trend of increasing infections across Australia as our government relaxes restrictions. Unlike other strains, Delta is causing a more serious illness and deaths in younger people when this is the case. It is almost invariably in the unvaccinated. Recent data indicates that unvaccinated people are 17 times more likely to be hospitalized due to COVID-19 than vaccinated people. Many public health experts now agree that herd immunity is unlikely, meaning that the high levels of vaccination in the population cannot be relied upon to protect those that are unvaccinated. In line with government guidance, we recognise that the path forward is through widespread vaccination in Australia. In the last month, we've seen some state governments announce they will start easing restrictions once the vaccinated population reaches at least 70%. As restrictions ease, we anticipate a corresponding increase in the circulation of the virus in the community within the weeks that follow, as has been experienced in other countries. This means unvaccinated people will be more likely to get COVID-19, making it more difficult for us to protect our families, our workplaces, and our local communities into the future. BHP has reviewed the status and effectiveness of COVID-19 controls in line with the latest scientific evidence and expert health advice. The science is clear that widespread vaccination saves lives. As governments move to reopen the country, full vaccination against COVID-19 will materially improve our ability to prevent a fatal or serious illness arising from COVID-19 transmission in a BHP-managed workplace. Based on the findings of our assessment, the company will introduce a requirement for COVID-19 vaccination as a condition of entry to BHP workplaces in Australia for all workers and visitors. We expect this requirement to come into effect fully from the 31st of January 2022. The requirement will come into effect on earlier dates when needed due to government public health orders or because of other risk factors such as the status of any local COVID-19 outbreaks and government reopening plans. The 31st of January 2022 date is intended to provide a fair and reasonable timeframe where the risk profile and government health orders allows for continued engagement and consultation, and for people to consider their position leveraging available support. So they've got some alternative dates here. WA. The effective vaccination dates for WA align with the state government public health orders. Exposed port, vessel contact workers will be required to have their first vaccination dose by the 15th of October and be fully vaccinated by the 12th of November. All other workers will be required to have their first vaccination dose by the 1st of December and be fully vaccinated by the 1st of January. New South Wales. Considering the current COVID-19 outbreak in New South Wales and the state government plan to ease restrictions, workers and visitors to BHP workplaces in New South Wales will be required to have their first vaccination dose by the 10th of November and be fully vaccinated by 31st of January 2022. In Victoria, the Melbourne office remains closed. For limited authorised workers who have access during the closed period, the state government requires these workers have had their first vaccination dose by the 15th of October and be fully vaccinated by the 26th of October. Further announcements will be made once the decision is made to reopen the Melbourne office. If future adjustments to effective dates are required, separate announcements will be made through local COVID-19 EMT communications, in addition to further workforce engagement. Supplementary vaccination requirements may be defined if recommended by the Australian Technical Advisory Group on Immunisation. The vaccination requirements will apply to all people seeking to access BHP managed workplaces in Australia, except for external emergency response personnel responding to an emergency, government officials, and members of traditional owner groups who are not employed or contractors. We will address on a case-by-case basis the small number of people with a medical condition that prevents the person from being vaccinated, as defined by the ATAGI. This decision has not been made lightly, and we appreciate that not everyone will agree, though we strongly believe this is the right path to protect the health and safety of our workforce, their families, and the communities where we operate, including remote Indigenous communities near our operations. We will continue to engage with our workforce and will consult with unions and other external stakeholders about the implementations of this decision. And they've got support and other issues here that you can contact. Now, here is, let's have a talk about this, everyone. Now, I'm not at all surprised. This is happening more and more, particularly on mines or facilities like this for these large corporate organizations. On the mines, they're like the power unto themselves. The requirement and restrictions they have to control access onto their sites, they can get around a lot of legislation that other people can't. So that's understandable. I'm not surprised. If they want to implement this to mitigate the health and safety risks, honestly, the risk of shutting down their facilities, I'm surprised it's not more widespread. It will be. We'll see this everywhere. This is going to happen. Think about it. What would you rather? Risk of shutting down or just not even noticing when something's happening on your site? Because that's really the two options. Sure, you've got the health and safety. Sure, you've got all these other issues as well. But you can't have a facility shut down, particularly remote. You don't want an outbreak in the middle of nowhere. There you go, guys. What do you think? Who's next? What will be the next business that will push this forward? And for those of you that don't know, I'm fully vaccinated. I did it really quick, really easy. I had no side effects. Frankly, I think the media is to blame for a lot of the hysteria and concern people have surrounding this, and the fact that, we've been lied to a lot by government regarding health, diet, and all these other things. So I can completely appreciate why people are very hesitant. What do you think? Would this be enough for you to quit your job over? Let us know in the comments down below. And thank you to the viewer that sent this through to me. Take care, guys. Have a great day. And if you're a fan of the channel and want to support us, there are a few ways you can. You can join us on YouTube or Twitch. You can help us out by using our affiliate links at Amazon, eBay, Independent Reserve, or AussieBroadband. You can sign up for Stake or SelfWealth. Every time you sign up with SelfWealth, we each get 5 free share trades, and I use them for my pocket money investing. You can sign up for YouTube or Patreon, buy our merch from HeiseSays, use Gold Pass from the Perth Mint, or support us via PayPal. Take care. I'll see you all next time. Bye for now.